Diabetes mellitus, or simply diabetes, is a form of metabolic disorder. Diabetes is a disease in which the body has too much sugar, or glucose in the blood. Glucose in the blood increases when insulin is deficient or the cells of the body do not respond to insulin. Insulin is a hormone that controls movement of blood sugar, or glucose, from the bloodstream into the cells. Diabetes is a chronic disease. Treatment is directed to control blood sugar and prevent any complications. One common complication of diabetes is hypoglycemia. Hypoglycemia is the condition wherein the body has too low blood glucose levels. The blood glucose levels drops when there is too much insulin in the blood. Too much insulin may be brought about by overmedication, eating a meal that has a lot of simple sugars, skipping a meal, eating later than usual, a diabetic person is hypoglycemic when they experience confusion, slurred speech, visual disturbances, palpitations, sweating, extreme hunger, trembling, headache, nausea and vomiting. Once a person is experiencing such symptoms, it is important to check the patient's blood sugar. If the blood sugar level is too low, take in foods with simple sugar. Simple sugars such as a sachet of table sugar, glucose tabs, juice, or soda are easily absorbed by the body and counteract hypoglycemia. If you do not have the ability to check the patient's blood sugar, it is important immediately to give glucose to any person experiencing such symptoms. Check the patient's blood sugar level after 15 minutes of food intake. If the blood sugar is still too low, take in another serving of simple sugar. If the symptoms persist or the patient becomes unconscious, call the emergency services or bring the patient to the hospital immediately. If the patient becomes unconscious, do not give him or her anything per oral. Call 977 and then bring the patient to the hospital immediately.